We classify venous disease from class 1 to class 6. It helps people communicate with each other. Class 1 would be somebody with spider veins. It's purely a cosmetic problem. They're very, very common, especially as one gets older, but they pose no threat to your health. So it's a cosmetic problem. They're treatable, but that sort of thing would not be covered by an insurance company, for example, because they don't lead to complications. It's a cosmetic issue. Then we get into class 2 disease. Class 2 are bulging, ropey, varicose veins. Class 3 is when the leg actually starts to swell. Class 4 is when the skin down by the ankle starts to change. It gets thick and brawny and brown. Class 5 is what we call a healed ulcer. That's the skin is broken down in the past and healed. And C6 is an open ulcer. It's a useful classification system because as one goes from class 2 to class 6, the severity of the disease obviously has increased and the number of systems involved in the disease has increased. When we talk about veins in the legs, there's 3 systems: the superficial system, the deep system, and the perforating system that communicates between the two. And typically somebody with earlier disease, like class 2, bulging, ropey, varicose veins, will have superficial vein problem, which is usually the saphenous vein. The saphenous vein runs in the groin, down the inside of the thigh, down the inside of the calf to the ankle, and it returns blood to the heart via the superficial tissues. It's not a main vein. It only carries about 8% of the blood back to the heart when it's normal. But when this vein breaks down, which is very common, it's the most common condition that we see, that means that the valves inside of the vein become leaky and the vein takes blood the wrong direction. The blood goes down the leg into the ankle instead of going up the leg into the heart. So bulging, ropey, varicose veins are usually a class 2 disease, one system, the saphenous vein, easily treatable with the new techniques, endovenous laser ablation, endovenous radiofrequency ablation. This is covered by insurance because it's a true medical problem. If you leave this untreated, it will get worse. You will progress to class 3, class 4, class 5 disease, just like a book. Once we get into more severe disease, especially like a class 4 where the skin is now brown in the ankle, that's a little different animal. Usually that means the superficial veins are involved, some deep veins are involved, and perhaps some perforating veins are involved. And the new frontier for these patients is that now we have a couple things available for the deep veins that we didn't have before. And the new tool is IVUS, intravascular ultrasound. That's an ultrasound at the tip of a catheter that we can now go inside of the vein via a wire and see inside of the vein with ultrasound. And now we're detecting lesions up in the pelvic veins that we couldn't see before, and these are amenable to stretching them with a balloon and placing a stent. So when you break it down, superficial veins tend to leak and we want to close them with lasers, but deep veins become closed and we want to open them with balloons and stents, kind of 2 different approaches. But that's kind of where we're at now with vein disease. We know it's progressive, and as it progresses, more systems become involved. The good news is we have minimally invasive technology for all forms of disease now. These used to be radical operations, be it superficial veins, deep veins, or both. They were big operations to deal with in the past that are now with guide wires and balloons and stents and lasers, all via percutaneous or needle holes.